Acute coronary syndrome is a phrase used to describe several ailments connected to abruptly decreased heart blood flow. Heart attacks, myocardial infarction, are one such condition where damaged or destroyed heart tissue results from cell death. Even when acute coronary syndrome does not result in cell death, the altered heart function indicates a greater risk of a heart attack. Acute coronary syndrome frequently results in excruciating chest discomfort or pain. It is a medical emergency that needs to be identified and treated right now. Enhancing blood flow, managing complications, and averting future issues are among the objectives of treatment. Symptoms. Acute coronary syndrome symptoms and indications typically appear suddenly. They consist of angina, or discomfort in the chest, which is frequently described as aching, pressure, tightness, or burning chest pain moving to the arms, shoulders, upper abdomen, back, neck, or jaw, nausea or diarrhea, indigestion, breathing difficulty, dyspnea, abrupt, profuse perspiration, diaphoresis, dizziness, lightheadedness, or fainting, unusual or unforeseen exhaustion, feeling anxious or restless. The most typical symptom is discomfort or pain in the chest. However, depending on your age, sex, and other medical issues, signs and symptoms may differ dramatically. If you're a woman, an older adult, or have diabetes, you're more likely to experience signs and symptoms without experiencing any chest pain or discomfort. Causes. Typically, plaque buildup in and on the walls of coronary arteries, the blood channels that supply oxygen and nourishment to the heart muscles, causes the acute coronary syndrome. Blood clots occur when a plaque deposit breaks or fractures. The blood supply to the cardiac muscles is cut off by this clot. The cardiac muscle cells may perish if their oxygen supply is too low. A heart attack is the death of cells, which causes harm to muscular tissues, myocardial infarction. Heart muscles don't function as they should even when there is no cell death because of the drop in oxygen levels. Either a temporary or permanent change has occurred. Stable angina is the term used when acute coronary syndrome does not result in cell death. Risk factors. The same risk factors apply to various forms of cardiac disease as well as an acute coronary syndrome. Risk elements for acute coronary syndrome include aging, elevated blood pressure, high cholesterol levels, smoking cigarettes, lack of exercise, unhealthy eating, obesity or being overweight, diabetes, family history of heart disease, stroke, or chest pain, pregnancy-related history of high blood pressure, preeclampsia, or diabetes, the COVID-19 virus.
For any questions, leave a comment below and don't forget to subscribe.